WA's Perth and Peel regions have begun the first day of a 3-day lockdown following a COVID-19 outbreak in a quarantine hotel. The lockdown was imposed after a 54-year-old man tested positive in Melbourne after completing 14 days of quarantine at Perth's Mercure Hotel and spent up to 5 days in the community while infectious. A woman he stayed with after completing quarantine has also tested positive after having a rapid COVID-19 test.
During the lockdown, residents of Perth and Peel will only be permitted to leave their homes for essential reasons, including work, grocery shopping and medical care. Now, Anzac Day services in the affected regions have been cancelled. Evelyn Manfield joins us now from Perth. So Evelyn, just take us through the restrictions that are there today.
Well, they've come in overnight at midnight, so people are waking up today to a very different day than they had yesterday, perhaps. Restaurants, businesses, gyms, places of worship, all sorts of places like that are closed as part of this short, sharp 3-day lockdown. We're at a testing clinic as part of Royal Perth Hospital and queues are sort of starting to build. They're just letting people in now. And so some of these people either have symptoms of COVID-19 or they've been to one of these potential exposure sites during sort of that window that these two infectious people have, been around the community during that period. So people are coming to get tested. It really wasn't that busy early this morning, but crowds are sort of starting to build slowly now after just a crazy day at the clinics yesterday.
I came at about 6:30 in the evening and there was such a long queue, but very helpfully someone came along and said, look, this is the point at which we won't be able to test any more people before 10 o'clock. Please come back tomorrow. So that's why I'm here at 6:15. I think it's so essential we're all tested, and the sooner we are, the sooner we get back to the life that we would really like in Western Australia and have been so lucky to have had. But it's good planning that's important for that too. So I'm sure that's why we all want to be here.
And Evelyn, how has this lockdown impacted travel in and out of the state?
Well, things were looking pretty open for a moment there. The New Zealand travel bubble was up and going with Western Australia as well, but that's come to a pause and New Zealand has paused flights with Western Australia. Now, other states and territories around the country are moving to, put restrictions in place as well. And throughout the day, we're expecting to hear from other state authorities about what they'll do, to put restrictions on people from the Perth, Peel or wider WA region throughout this 3-day lockdown.
And of course, presuming that events will be affected this weekend, particularly Anzac Day ceremonies.
That's right. There were, big events planned for tomorrow, especially up at Kings Park where the State War Memorial is. Thousands of people were supposed to be going to that Anzac Day service. That won't be going ahead, as well as other ones around the city. So people will really be asked to go to the end of their driveway, similar to last year, and pay their respects for Anzac Day. The RSL has spoken about this too.
We strongly encourage people to do what they did last year at this time and get involved in the Light at the Dawn driveway dawn services from their own homes, their own balconies to the farm gate. It was a great way to commemorate from home last year, and we're encouraging everyone to do the same this year.
All right, it isn't the first time that Perth has been under a lockdown, but what's been the response from residents and businesses to this recent lockdown?
Well, people at the 2 COVID clinics that we've been to have been quick to respond. They've been checking those potential exposure sites and coming here to get tested, or if they've got symptoms, coming to get tested. So, it seems like people are trying to sort of play their part in this lockdown, which is certainly what the government is asking people to do. Everyone that I've seen this morning is masked up, which is part of the requirement that came in at 6 o'clock last night as well. So, but as you said, it was only at the start of February that WA and, a big part of WA went through a 5-day lockdown. So this will be really tough on businesses, who have continually suffered as a result of COVID-19.
Just take us through the number of people who've been linked to this hotel cluster now.
So this is at the McCure Hotel, which is a quarantine hotel in the Perth CBD. So this man, this 54-year-old man who's then travelled on to Melbourne, was staying there, completed his 14 days of quarantine, tested negative during that period, came out, went about his business, and saw a friend or stayed with a friend here as well. He's since tested positive, and that friend has tested positive to a rapid test as well. Now, he was staying in this McCure hotel where travellers from the UK caught the same strain of the virus as people who were who travelled from India. So there was a pregnant mother and her 4-year-old daughter there as well. So it is a growing cluster, and we'll wait to see today if the cluster has stopped or, if the government has more cases to announce. We don't know that yet.
All right, Evelyn Manfield there reporting for us in Perth. Thank you. Moving on to other news now, and there have been additional cases of blood clots in people who have received the AstraZeneca coronavirus vaccine. The Therapeutic Goods Administration says the cases are in a 35-year-old woman from New South Wales, a 49-year-old Queensland man and an 80-year-old Victorian man. All three are clinically stable, have responded well to treatment and are recovering, with 2 of the cases considered to be mild. There have now been 6 such cases recorded in Australia, including 1 death.
India has set another world record of new COVID-19 infections in the past day as leading hospitals in the wealthiest states run out of oxygen. Several countries are now closing their borders to India, which counted 330,000 new infections and more than 2,000 deaths in 24 hours. Officials are warning the true number is much higher. Hospitals are struggling to keep up with the surge in cases, and crematoriums have resorted to mass funeral pyres to deal with the rising death toll.
India is going through a very terrible situation right now. They've had yesterday the largest number of cases that has ever been reported by any country. They have a situation there where there are variants that have arisen. We have not yet fully characterized the variants and the relationship between the ability of the vaccines to protect, but we're assuming clearly that they need vaccines. The CDC is helping out by consulting with them, as they have in other countries in which there are situations, and giving technical assistance. But it is a dire situation that we're trying to help in any way we can.
3/4 of the positive cases in the latest New South Wales hotel quarantine figures are people returning from India. National Cabinet this week announced a temporary 30% reduction to the number of incoming flights from the country. Departures to India are also being limited.
Advisors to the US Centers for Disease Control and Prevention have recommended vaccinations with the Johnson & Johnson shot should be resumed for all adults over the age of 18. The vaccine was paused by the US regulators last week after reports of rare blood clots. Health officials say they were aware of 15 cases of the usual clots from nearly 8 million shots administered. They're insisting the benefits of the vaccine far outweigh the risks.